This is Morning Cafe. I'm used to Stanley Nyeringeti. It's a Monday, and around this time we discuss matters health. And our conversation for today is a conversation that has been happening in the country for quite a while. Endometriosis, you probably have a glimpse of what it is, but then this morning we have an expert to tell us what really it is. Just taking a look at and breaking it down, and even allowing you and giving you the opportunity to share in with your experience, and also ask any kind of questions that you have. That is our question for the day for you. Do you have any questions regarding endometriosis, or would you like to share your experience? 0795 045 864 is the number to call us live. 0793 267 279 is our WhatsApp number. Dr. Bruce Samo is an obstetrician as well as a gynecologist. Karibu sana.
Thank you so much. Thank you for having me.
Oh yes. So today I want us to break down this conversation, right, and this condition bit by bit, because I mean it has been happening in the country. This conversation has been going on. People are really wondering what endometriosis is after losing TV star Fire Mama Njombe. So first off, what is, even as you also give us your introduction, who is Dr. Bruce, what is endometriosis?
Right. My name is Dr. Bruce Semo. I'm an obstetrician and gynecologist, and very keen, developed an interest in what we call laparoscopic surgery, which majorly is one of the approaches to the management of diagnosis and diagnosis of endometriosis. Now, before we discuss endometriosis, I think it's very important that we understand the anatomy, or rather the structure of the female pelvis. Yeah. Okay? And one of the major structures of the female pelvis that we will delve on today so much is the uterus. Okay? And so the uterus is actually a pear-shaped organ that is normally in the female pelvis, and it has a cavity inside. Now, this cavity has three connections. Okay? So we have the lower part of the cavity, which is actually the opening of the uterus where the blood normally flows out during the menstrual cycle. This is the cervix. And then on the upper part, we actually have two connections, which is the fallopian tubes. So the fallopian tubes actually open into this cavity of the uterus. Now, the inner cavity of this uterus has a special lining inside, which is the one that majorly is involved when it comes to the menstrual cycle. Of course, there's a lot of factors that come into play when menstrual cycle is involved. Now, this cavity, the lining of this cavity, is what we call endometrium. So it has special cells, and these cells are normally responding to hormonal changes during the menstrual cycle. And at the end of the menstrual cycle, in the event that a woman does not get pregnant, then it is the one that sloughs off and sheds through the cervix, and we call that menstruation. Now, in the event, for whatever reason, we have some of these cells being found outside the uterine cavity, okay? So ectopic uterine tissues, then we say that is endometriosis. So endometriosis is a condition that is characterized by ectopic functional endometrial cells and glands within the outside part of the endometrial cavity. So that is what is called endometriosis.
Right.
Okay.
So despite the fact that quite a number of medics would say the cause isn't really known, but then there have been studies over and over to really try and debunk this. So according to even the World Health Organization, and I want you to also help us debunk this, because even as someone who probably knows my loved one has endometriosis, or even themselves, they definitely go to Google and try to really search what is the whole root cause. So one of the causes, according to World Health Organization, saying retrograde menstruation, when menstrual blood containing endometrial cells flows back through the fallopian tubes and into the pelvic cavity at the time that blood is flowing out of the body through the cervix and vagina through periods, as well as cellular metaplasia, and stem cells can give rise to the disease, which then spreads through the body via blood and lymphatic vessels. So it gives about three of them. Help us understand, let's say, these particular causes that WHO outlines for us.
Yeah, so there's not really single identified cause. There is normally retrograde menstruation, meaning at the time when a woman is menstruating, instead of the blood flowing through the cervix and out through the vagina, these sloughed off tissues of endometrium and blood sometimes tend to retrograde, to flow back through the fallopian tubes and into the peritoneal cavity, where they attach on different structures, like the ovaries, the ligaments, and sometimes even the bowel. Okay? So that's the first theory. But this theory does not explain to us how we end up with some type of endometriosis in different places. Mm-hmm. Like, for example, if it was retrograde menstruation, then how do we explain having endometriosis in the lungs or even in the brain? There's some people who've been found to have endometriosis in the brain, in the eyes. Okay, so endometriosis can occur in so many places. And the other theory that maybe tries to explain that is something called coelomic metaplasia. Okay, which basically just means that there are some cells in some areas which undergo some changes to become endometrial cells. Okay? And this can explain how we end up with endometriosis in the pleural cavity, can explain how we end up with endometriosis in the bowel and these many other areas. Mm-hmm. But there are other factors also that have been brought up to explain. There's a genetic predisposition to development of endometriosis. They're what we call stem cells. Stem cells are the youngest cells at the time a human being is developing. Yeah. And some of them have been thought to be left behind at the time a human being is developing. And these cells have the potential to grow and become any type of cell. Mm-hmm. Okay? And when that happens, then we say that they might have that propensity to develop and become endometrial cells within the area where they were left. And then they start acting and responding to the hormones which are being released and acting in a manner likely to be the ones that are inside the endometrial cavity. So the chances of even endometriosis being hereditary, right? Yes, the chances that if you had a relative who has endometriosis, the chances that you will have endometriosis is actually 7 times higher. Okay, so there's a genetic component to it. So we think it is actually a constellation of all these factors that predispose one to have endometriosis. Mm-hmm. But there is no single point factor that we can say this is exactly the reason why you have endometriosis. All right. Yeah. So typically, when does it start to occur for someone who has endometriosis? Unfortunately, and especially in our local setup, mm-hmm. The diagnosis of endometriosis happens very late. So a lot of times we catch the disease when the patient has actually been suffering for quite some time. The average has been known to about 7 to 10 years. Probably in our setup it is even higher, mm-hmm. For several reasons. But it is a disease that is known to be affected by, the growth and the response of the endometrial cells is actually hormonal. So it is the reproductive age group, okay? So we don't say that women or the ladies who are at school don't have endometriosis. They may have endometriosis, but in the early phases. But women between 35 to 45 years of age are the ones who are commonly being diagnosed with endometriosis. And sadly, most of them, by the time they're being diagnosed with this condition, it's normally a state when they have been suffering through so long, mm-hmm. That we come up with the diagnosis of endometriosis. So typically in your many years of experience, really, how, at what age, the younger age, can some of this, the prevalence of it start? One of the challenges of making diagnosis of endometriosis is that the symptoms are very vague. Okay? And so we have even seen it in girls who are 13 years old, 14 years old, who are going through their menstrual cycle. But if you look at the presentation of endometriosis, so endometriosis presents with 4 common features. So number 1, these patients will present with pain. And the pain is very vague, okay? So most of them will go to hospital and then they're being diagnosed with urinary tract infections. Some of them have even been labeled to be having sexually transmitted infections. They may present with bloating. I'm sure you've heard of some group of women who are always walking around with painkillers, paracetamol and diclofenac in the bag. And there's this socialization of our young women, especially by our elder mothers and our grandmothers, to believe that pain during the menses is normal, okay? And so we are seeing it in high school girls. If you're keen, you'll notice that there are some girls who at the end of every month, they're always out of school. They're in hospital getting, painkillers, injections, and being admitted for all manner of things. And they're being labeled as having low threshold because, menstruation is normal, right? And menstrual pain is normal. That's what we are telling them. Mm-hmm. What we don't know is that most of these patients who actually have excruciating pain during their menses may actually be having very early phases of endometriosis that we don't know about. In the late phases, most of the time, the women will come with infertility because that's the other thing that has been caused by endometriosis. So how do you, and how does a medic then label these phases? Does it go with the pain threshold,
how do you say this is the first phase, this is the second phase, these are the late phases? Does it go the pain threshold?
So because of the variety in presentation, depending on the location of the area that has been involved with endometriosis, the diagnosis of endometriosis depends, number one, on the symptoms. So we need to be very cautious about the symptoms, and we need actually a lot of advocacy on women. We need to tell women that it is not normal to have excruciating pain during your menses. Okay? They present with pain during menstrual flow. They present with pain during passing of stool or during passing of urine. So when you put these symptoms together, then you can actually come up with a clinical diagnosis of endometriosis at a very young stage. But there is no stage-wise development of endometriosis. There are some patients who are actually asymptomatic. They don't have any symptoms, but they have endometriosis.
Right.
And then there are some who actually have very vague symptoms like bloating or pain when they're passing stool, early satiety, or some that will just present with chest pain or shoulder pain, and they actually have endometriosis. So there's no staging of what endometriosis is. But there are common classifications, different type of classifications that have come up. So you'll find we have what we call peritoneal endometriosis, depending on the location. The most common one, which is the ovarian endometriosis, and you see a lot of women coming in and they say they have ovarian cysts, which is another discussion all in all. And then you can have what we call deep infiltrating endometriosis. This is the most advanced stage that in most cases may require surgery. Yeah.
Right. And take a look at, let's say, even some of this. So can we call them the types? The one that you mentioned, the superficial, the cystic ovarian, the deep endometriosis.
Yeah.
So because you told us chances of, let's say, your relative having endometriosis, you're 7 times higher to also have it. So let's say someone knows that, well, my auntie had endometriosis, or probably has, and for her it was maybe, let's say, the brain, or maybe for the lung. Will chances be the same that this person will also have in the same location?
No. That's not how it works. Okay. Like we said in the beginning, that we don't really know what causes endometriosis. So we can't really predict that if your auntie had endometriosis, pulmonary endometriosis, that the chances you're going to have pulmonary endometriosis is higher. What we know is that you will have ectopic endometrial glands located in different places outside the uterus. Okay? Yeah.
Right. Let's talk about now the different diagnostic options. This person has come to you. And actually, even before, so they actually come to this health facility, can they themselves, let's say, know that I have endometriosis even before walking to the health facility? And even now, if they come into you and they say, hey, Daktari, I feel like I have these symptoms that you have told us. What kind of diagnostic options would you provide for them?
There has been a lot of advancement in the manner in which we are making diagnosis of endometriosis. But of course, the first thing is to understand the symptoms, okay? So let us advocate for women, number one, that it is not normal to feel pain during menses, because that is one of the most common presenting symptoms, okay? So we look at the symptomatic presentation first before we do any investigations. So women who are having pain during their menses, women who are having pain during intercourse, women who are having heavy menstrual bleeding, okay? Women who are having either bloating or pain during passage of stool, women who are having pain when they are passing urine and they've been treated for several years for urinary tract infections, and they keep coming back and they're saying, this thing keeps on getting treated, it disappears and it comes back, okay? So those are signs that would already point to you that there's a possibility that this patient actually has endometriosis. Now, in the past, and this has been one of the problems that we are facing in this country, was that the diagnosis of endometriosis was done, the confirmation that you have endometriosis was actually done through a process called laparoscopic diagnosis. So this is a process where there is actually a small camera that is put inside the abdomen with light, and then they distend the abdomen using some special gas. And through visualization of the structures inside the abdomen, they can actually be able to see these endometrial cells. Okay, but currently there has been a lot of discussion about the invasive approach to diagnosis of endometriosis. So the current approach is actually a special type of ultrasound diagnosis. Okay, so the types of ultrasound equipments that we have come up with have actually changed, and now endometriosis can actually be diagnosed through ultrasonography, and it's actually the gold standard for diagnosis. But unfortunately, it depends on the location of the endometriosis also, number one. And two, there is a lot of lack of training in use of ultrasonography, because ultrasound diagnosis is user-dependent. So there is very vigorous training involved for someone to be able to make the diagnosis of endometriosis using an ultrasound. So the other thing is we can also do magnetic resonance imaging, but you can imagine the cost of that, and especially for the people in the low-income communities, not being able to afford it. So based on that, most of the time the diagnosis is normally made on the clinical presentation. And once we do the clinical presentation, then we do a presumptive diagnosis and we initiate the treatment. Okay. But right now we are encouraging a lot of training for the obstetricians and gynecologists to be able to pick endometriosis through the clinical presentation, and also be able to acquire that skill to do ultrasonography to be able to pick endometriosis among these women. Yeah.
Right. So even before you continue, a reminder to the viewer, 0795-045-864 is the number to call us live. It's just below your screens right now. Save this number right now and tell us, rather ask those questions, all those questions that you have. Being told Lucy from Kinangop. Lucy, habari asubuhi.
Nzuri sana.
Thank you for calling us this morning. Do you have any questions or comments?
Nilikuwa nauliza.
Yes, you could probably have the sound hapa kwa studio.
Nilikuwa na uchungu sana when I'm having my menses.
Yes.
And every time lazima niende kwa daktari nidungwe sindano. Yeah, every month when I'm having my menses. Inaweza kuwa ni endometriosis. Hello.
Yes, Lucy. Tumepata swali yako. Daktari will be answering your question in a few.
Okay.
Thank you very much.
Most common presentations that women come with in the clinic. Now, while there is a high probability that it could be endometriosis, we must understand that there are many other causes why a woman will feel pain during her menses. Because we have issues like uterine fibroids, okay? We have ovarian diseases. We have conditions involving the colon, the bowel, and the rectum that can actually cause pain during menses. We have congenital abnormalities. So the best thing that I normally advocate is that if you realize that you are experiencing pain during menses, then the best thing is actually to get professional advice from a specialist to be able to actually make that diagnosis. Like we said, there's a history that they have to connect, and then there are certain investigations that they have to do for them to be able to initiate the treatment. But if you are having pain during your menses to an extent where you actually need to go to hospital to get injections, and this pain is constant and it has been lasting for more than 6 months, then the chances that you're having endometriosis is actually quite high.
Okay.
Yeah.
Right. We have another caller all the way to Mombasa. Ruth, habari asubuhi.
Salama, umeamkaje?
Sisi tumeamka salama hapa studio. How is Mombasa?
Mombasa is cool.
Kuna swali au kuna maoni?
Niko na swali na nawashukuru kwa hichi kipindi.
Thank you very much.
Maanake I've suffered urinary tract infection for the last 14 years. Salama.
Tafadhali Ruth, mute TV ama pale unatusikilizia. Mute ama uzime ndio tupatane vizuri.
Aya.
Umefanya hivyo?
Unanipata?
Yes, tunakupata. I hope umemute ama umezima.
Nime-mute.
Thank you very much. Haya, uliza swali sasa.
Sasa hiyo UTI imenisumbua sana. Sijui nitafanyaje
sawa. Ruth, naambiwa tafadhali mute tena, then you can call us back. Ruth from Mombasa, and ask those questions. 0795-045-864 is the number to call us live when you're calling us from. Wherever you are, tell us your name, where you're calling us from, and tafadhali just mute your TV or have it off so that you can have a seamless conversation with you. The number to call us live is just below your screens. 0795 045 864 as you have this conversation on endometriosis. Ladies, you can also tell us, how do you deal with the whole period symptoms? When it really gets painful, as Dr. says, you shouldn't really normalize it. But what do? You can also share with us your experiences on the same. So I had cut you short, the previous question from Nairobi.
Yeah, so when we are talking about pain during menses, the one thing that we have to understand is that there are many causes of pain during menses, okay? And so we can't say any woman who has pain during her menses has endometriosis. Pain during menses is called dysmenorrhea, okay? So there are two types of pain during menses. So there's what we call primary dysmenorrhea. This is pain that happens during menses. It is not very severe, but it is actually something that still needs attention. It needs treatment, okay? It does not have any pathological cause. The main reason is because of the chemicals that are being produced in the uterus during menses that causes extreme contraction, what they normally call cramps, okay? But it is not so severe to an extent that it impacts, your social life or your daily quality of life. Then we have secondary dysmenorrhea, which is the secondary pain that women experience during menses. And this is where endometriosis comes in. So most of these women normally have endometriosis, but because of the socialization, they've come to believe that it is normal to experience pain during menses. So my question normally is, how normal is normal for a woman to have pain?
What's the threshold?
Okay? What is the threshold? So if a woman is always missing work 2 to 3 days every month because she's in pain for her menses, yet other women are coming to work, you see there's already a lot of stigmatization. We are appendicasi. That's what they say. But these people could be having other conditions that are causing secondary dysmenorrhea. Endometriosis is one of them. Uterine fibroids, depending on the degree of involvement. We have infections, pelvic inflammatory disease. Okay, we can have conditions involving the bladder. Okay, so just because you have a condition that is causing pain when you're passing urine, it does not mean that you have urinary tract infection. There are many other diseases of the bladder that can actually cause pain during menstruation. And unfortunately, most of these women normally label themselves as having urinary tract infections for a very long time.
Right. We have another caller. I believe it is Jeff from Nairobi. Jeff, habari asubuhi. Joy kutoka Nairobi. Habari asubuhi. Joy, kama unaweza nipata, habari asubuhi. Talk to us this morning. Right, ni kama Joe amepotea. 0795 045 864 ndio namba ya kutupigia simu sahihi as we discuss matters endometriosis. Do you have endometriosis? Do you know someone who has endometriosis? Would you like to share with us all those experiences, or is it something that you'd really like to know? And you have quite a number of questions. Kwa akili, Dr. Bruce will be answering them with you, just helping you understand this particular conversation. Ladies, also, you can tell us, how do you deal with the whole matters, as Dr. says, matters the whole period pain and the whole period symptoms? How do you deal with that? Talk to us this morning. Yes, sorry to cut you short.
Yeah, so that's it. So when we're talking about pain, we have to be careful, and we should not self-diagnose ourselves. Women should not self-diagnose themselves and say that, I have this urinary tract infection that has been treated for this long. Okay. The best approach will be to actually seek a specialist, attention, so that they can be able to also work with you and try and identify where exactly the problem is.
Right.
Yeah.
We have another caller, Tesi kutoka Kayole. Tesi, habari asubuhi. Stacy kutoka Kayole.
Okay, I'm Stacy kutoka Kayole.
Yes, unaweza paza sauti yako Stacy tafadhali?
Mimi niko na swali.
Yes, uliza.
I've been diagnosed na infections. Na nimepimwa vitu mingi sana like cancer. Nimepimwa PID.
Okay.
Na nikapimwa sensitivity ya urine.
Okay.
But sijawahi pata matibabu vizuri.
Right.
So nauliza daktari, inaweza kuwa ni nini na nifanya nikuwe hivyo?
Okay.
Okay.
Asante sana Stacy kutoka Kayole. Daktari atakuwa na kujibu saa hii tu. Thank you Stacy for that.
Yeah, so as you can see, most of the stories that we are getting is I've been having this problem for this period of time. And I'm not getting, satisfied with the approach of treatment that I am getting. And it's a common story in not just in our setup, but across the world. Women are going through pain, and there's a lot of trivialization of women who are going through pain. So for such a patient, I would advocate that she seeks care from a specialist who has, done a lot of advanced training in pelvic pain and preferably endometriosis. We do a lot of ultrasounds for women who have pain. But the problem is the people who are doing the ultrasounds have actually not been trained adequately to make a diagnosis of endometriosis using ultrasonography. And unfortunately, we have very few centers in East Africa in general that have actually been allocated specifically for management of endometriosis. Endometriosis is not a one-man war. It's actually a team of doctors who actually come together to actually be able to manage it and come up with a decision on what approach to treatment they should be getting. So if you have been treating yourself, or if you've been getting treatment for a certain condition for so long, then I'll advise that you actually seek treatment from an endometriosis specialist or an endometriosis center. Yeah. Right. Otherwise, the discussion of I have been having this pain for this period of time and it is not getting well, there is a series of approaches that we normally take. And so if we do the clinical diagnosis and we put you on treatment and it's getting worse, then we go to radiological diagnosis. So we do the ultrasound, we can do the MRI. But there's even an advanced approach, which is the laparoscopic diagnosis. So we can actually be able to do surgical investigations where we put the camera, like I said, and we actually be able to visualize the structures inside the pelvis and see what exactly is going on so that we can be able to understand where the source of the pain is coming from.
Right. Now getting to Mati's even surgeries, and I remember Njamiko Ikai before her death saying that she's undergone more than 20 surgeries, and just even taking a look at even a number of people, endometriosis patients, saying they've undergone quite a number of surgeries. Why is this case that they have to undergo this amount of surgeries?
So if we go back to the pathophysiology, the occurrence, the manner in which endometriosis happens, we must understand one thing, that endometriosis has no cure, okay? I'm not saying it can't be treated, I'm saying it has no cure, which means there's no way of completely eliminating the disease.
So again, there's a possibility of recurrence? There
is a possibility of recurrence. But even with that, there has been a lot of, a gap in the training of surgery for endometriosis.
Right.
And so you'll find most of these people who are going through these several surgeries, either the surgery is being done but they're recurring, or it is being not done but not adequately as per the required standards.
Right. Allow me to interrupt you there. Let's hear from Muthoni kutoka Olkarau. Muthoni, habari asubuhi?
Njema.
Thank you for calling us this morning kutoka Olkarau. Naomba utapaza sauti as you call us, as you ask Olkalau. Yes, ndio naambiwa ni Olkalau. Ukiuliza swali au maoni.
Hello?
Yes, tunakupata. Endelea na swali au maoni.
So I've been having this pain.
Okay.
I've been having this pain for quite a period of time.
Okay.
And when I approached a gynecologist,
he
said that it's because I'm fertile. That's why I get the pain, though it's not severe. I don't know whether to treat it severe or mild. But I have to take some painkillers every second and third day of my menses.
Okay.
And sometimes I skip work. Sometimes it's not that severe. Is it true that it's okay to have that pain?
Okay. So thank you, Muthoni, for calling us this morning. Dr. has got your question, I believe. He'll be answering it in a few.
Right.
I think in each and every call there will be the whole perspective
of pain. You can see the pattern is coming out. That it is normally pain. Then after pain, normally it's either infertility that brings them to the hospital, or if it is not pain and infertility, then normally it is just a reduced quality of life because of missing work and all that. So infertility does three things. Number one is that it causes chronic pelvic pain. Number two is in the process of these tissues being outside where they're supposed to be, they cause what we call inflammation, which causes damage to the structures of the pelvis, which causes inflammation. and then infertility. So the treatment of endometriosis or chronic pelvic pain, once we've made the diagnosis, involves management of this pain, okay? And there are several medications that are actually used to manage this pain. Occasionally, most of these patients, you find that they have gone through a stepwise approach and they've taken so many medications for this pain, but they're not taking the right medication for the endometriosis. And then there's something that we are not talking about, which is a very strong factor of endometriosis, that it actually causes infertility. And a lot of times...
I was actually getting to there.
Yeah.
Now, even after the surgeries,
yeah.
Getting into matters infertility, and according to symptoms by World Health Organization saying, I mean, we've mentioned this, the chronic pelvic pain, heavy bleeding during periods or between periods, and also trouble getting pregnant. And
yes.
that was one point that I'd really want us to even focus on, the whole trouble getting pregnant.
Yeah.
So does it mean even for, let's say, the lesions that probably would be, let's say, around the ovaries, would they damage the ovaries? Or rather, let's look at the ovaries, even the fallopian tubes, will they damage these locations? Tell us about that.
Yeah, so there are many mechanisms in which endometriosis causes infertility, although not all of them have been able to be elucidated. But one of the ones that we know is that endometriosis causes what we call inflammation. And inflammation is the body's response to foreign structures or an injury. And with that inflammation, then you start having scarring. Okay? So if you have endometriosis on the ovaries, then you find that it causes damages to the ovaries and it reduces the ovarian pool to an extent where now you either have subfertility or infertility. It can cause damage to the fallopian tubes, and the fallopian tubes are a very important component when it comes to fertility. The endometriosis itself, even if we look at inside the uterus for people who have endometriosis, they have a very foreign environment for a successful pregnancy because there are a lot of production of inflammatory mediators that make the endometrium not favorable for fertility.
All right. Well, getting back to that conversation on the infertility, let's pick this call first of all. Although to Kiserian, Carol, habari asubuhi. Carol, kama unanipata, tafadhali mute your TV, have it off, and then talk to us this morning. Do you have a question or feedback? Carol, can you get me?
Hello, mimi naitwa Carol.
Yes, thank you for calling us this morning.
Okay, mimi niko na shida nimekuwa nayo for a long time.
Okay.
Sasa ni 1 year.
Okay.
Na nimefanywa scan ya hiyo endometriosis.
All right.
Nimekuwa ni kila time nikihave periods na bleed kitovu.
All right.
Na imekuwa very painful.
Okay.
So sijajua nishafanya CT scan but wakasema nifanye tena MRI.
All right.
So sijajua shida iko wapi.
Okay, so we have Dr. Bruce here, and he'll be answering any of your questions. Probably kama uko na zingine nyingi, even after he answers, you can also call back for just make sure that amejibu vizuri ama for clarification of it.
Okay, sawa.
All right, thank you very much, Carol kutoka Kiserian. It goes
back to the pain.
Yes.
So for her, what I'd like to say is that I want to clarify that there are different types of ultrasonography that is done depending on the disease that you have. And the person who's doing the ultrasound must also have undergone a certain type of training to be able to actually pick endometriosis. So just because an ultrasound was done and they did not pick anything, it does not mean that you do not have endometriosis. We need to understand who did the ultrasound and what was their experience and training in as far as doing ultrasonography for endometriosis is concerned. So that is one of the gaps that we have in this country, that there is very little training, although there's a lot of advocacy now, and the gynecologists are going through a lot of training to be able to actually understand and be able to do these ultrasounds for endometriosis. But there are very few centers currently as we're speaking that can actually be able to do ultrasonography to pick deep infiltrating endometriosis and even worse superficial endometriosis, which is even harder to pick using ultrasounds. MRI is a good option, but even the person who's interpreting the MRI must have had it in mind what to look for when they're doing MRI for diagnosis of endometriosis. So for her, I'll advise that she tries and seeks a center that deals with endometriosis because not everyone who's doing ultrasonography actually has the experience and the skill to do ultrasonography for endometriosis.
Right.
Yeah.
Let's go back to the conversation on infertility.
Hey there friends, welcome to Kids on the Block, where fun and imagination come alive. We dive into magical world filled with exciting adventures and awesome friends.
What position were you in?
I was number 2.
What position were you?
Number 1.
He decided to cross the bridge by his house and look for food on the other side.
We're going to do half cup of chocolate chips, and the other one, we're going to do half cup of the blueberries.
So, grab your imagination hats and get ready to explore with us. Join us every Saturday at 9 a.m. for new friends, amazing stories, and tons of laughter.
Join us as we explore the journeys of those who defy the odds and break barriers. We dive deep into the stories of triumph.
Sometimes when parenting a child with a special need or whatever disability, family life becomes a bit complicated and you may end up raising the child on your own.
Here, we inspire.
I have a farm which one we showcase with other dyslexic youths and autism how to farm.
Motivate.
It's never easy, but what we do, the best thing is to work with another parent who has an elder child than yours.
And break through the barriers one story at a time. Push your boundaries beyond the limit. Saturdays at 8 p.m. The Grind, where business meets brilliance. It's not just about the ideas.
I was working as a shampoo boy. I used to wash clients' hair on the sink.
It's about making them happen. From big wins.
In primary school, when we would be asked what people want to be, I was categorical that I want to be a nurse.
To hard lessons.
The consoles change, the gaming equipment keep changing.
We cover it all. Tune in to The Grind, where every episode is packed with insights.
The person who is serving customers, always be a customer-centric.
Strategies.
When you pay attention to detail, you get lucky.
And stories to fuel your passion. Don't just feel it. Grind it. Mondays at 7:30
It is about
p.m.
4 minutes past the top of the hour. Karibu sana. This is Morning Cafe. I'm used to Stanley Nyuringita. Being a Monday around this time, we discuss matters health and wellness. And today I want to take you all the way to China, to the whole Asian countries, because we're talking about something that has been in existence for thousands and thousands of years.
Which specialize in a holistic wellness. And that's why part of our treatment incorporates the use of heat. And today I'm really excited that TV47 have given me this opportunity to come and share a word or two in terms of how we can improve our health and wellness using naturally available products. This for me, old school medicine is really something that it's entrenched in me. For one main reason, it has survived time. It has survived time. Our grandparents, their parents, their great-grandparents have used it. What is interesting is that even in Africa here, we used heat in various forms of using different leaves for healing. But let's now focus on Moxibustion. Moxa is it's it's a plant that is called magwort, and the plant that is called magwort, it's normally harvested.
Okay.
And when it's harvested, it's dried for about 3 years.
Right.
And then once it's been dried, in a twango na kinu, it's always pounded.
Okay.
It's pounded and pounded and pounded until you are able to get it into this fluffy, spongy type of material.
And Dr. even as you continue, if for purpose here, viewer level, what plant we're talking about,
yes,
you might have maybe seen it here in Kenya. We're in a short while going to be showing you what this image is, Yezi magwort ninini.
Yes. Yes. So when the magwort has been pounded and pounded and pounded and pounded, then it can now be used for a variety of ways. However, there are two main ways of applying Moxa. One is called direct Moxa, and we're going to be doing a practical to show direct Moxa. Then we also have what we call an indirect Moxa, is another way of utilizing Moxa. And then, but before we go there, maybe I need to take you through the different types of Moxas so that the viewer can understand.
Oh yes, because the table is quite full.
Yes.
And there are quite a lot of things that are quite new, even for the viewers. So I think one by one you can walk us through what we are seeing on the table.
So let me start here. So this is a box of Moxa, Moxa that has been compressed and actually set as a smokeless Moxa. What you need to know is that raw Moxa, when you burn it, it has a lot of smoke, and because of the smoke, sometimes people don't like it. So over time now, technology has helped us to be able to improvise, to change this Moxa into a smokeless Moxa. So this is a smokeless Moxa. Now, these kind of Moxas, they come in different in different kinds. These kinds are determined by the heat they emit. So like this one that I'm showing you, when you heat it, it heats the skin up to about 37 degrees centigrade. And then we have another one that will go slightly higher. This one is smokes. It's going to 38, 41, 44, 47, and 50. Now, what we need to realize, to understand, is that these are the different heats, how strong the heat is going to be emitted in the body.
Okay.
So this is one type of Moxa.
Right.
The second type of Moxa.
So that's directly placed on the body?
Yes, this is direct. Actually, it's a sticker.
Okay.
It has a sticker. So you remove the sticker.
Right. Then you.
Then you light it. Once you light it, then you place it in the body to burn.
For how long?
Normally it's about 3 to 5 minutes.
3 to 5 minutes.
Yeah, for this one.
Okay.
The other bigger ones can take a little bit longer. Yeah.
So you'll be telling us the basic purpose, really.
Yes,
we'll go through that.
Yes, we'll go through each.
Yes.
The next kind of Moxa is a stick Moxa. The stick Moxa is also a smokeless Moxa. Also, we have two types of this Moxa. We have the one that produces smoke, which is more tradition, and we have the modern one, again, which has now been compressed like this one. It's called a stick Moxa. This stick Moxa has many advantages. One is that a patient can be given to do the therapy on themselves. Because some of these treatments, sometimes you need a continuity. So instead of you depending on me all the time, I guide my patients sometimes to be able to do the Moxa on their own. So you burn, you heat up this one, and then you're gonna use it. I'm gonna show you how you use it.
Right. So viewers this. So this is as you call it, the stick Moxa. So again, you burn this?
Yes. You heat it up.
You heat it.
You burn this until it gets like a charcoal burn.
Okay.
Once it gets a charcoal burn, it doesn't go off. So then you are able now to apply it in the area you want. You can also guide your patients to use it. It's actually.
What has been mixed with this? Because for the Moxa that I'm seeing for the corn and this other one, it has that brownish color.
Yes.
These are the leaves of that the magwort.
It is the same.
So why is this black and ingredient brown?
This one has been compressed.
Okay.
The same Moxa can be added a few other herbs, and then it's compressed in a machine to produce a pallet of charcoal like this. Okay. And this is the pallet that now we heat. It is the same product.
So you burn this, do you put it directly in the skin or indirectly?
No, it's indirect.
Indirect, okay.
Yes, yes.
So the second technique you're talking about?
Yes.
Okay, good.
Yes.
So this is stick, so the other?
Moxa. Then we have...
Now this, it's smokeless?
Yes, it's a smokeless pallet, again.
Pallet, so it also has a sticker?
It also has a sticker. It's also, you remove the sticker, you light it, and then you place it where you want to place. It's normally placed in very, very specific spots of the body.
Right.
Yes.
Does this contain charcoal? Because it's gonna...
Yes, because of that compression of the heat. For that to form this, it has to pass through heat. So that's why it turns black.
Right.
Yeah.
Okay. It has a particular black substance.
Yes.
It leaves a particular black substance.
Like charcoal.
Yes.
Almost like charcoal. Yeah.
So you have that. Remind us the name?
These are Moxa pallets.
Moxa pallet, okay.
Yes.
So from pallet.
So you have pallets that you stick, and you have pallets that you can put on a needle.
Okay.
Again, you also have this in raw form, in this form. We are only using more of this because of smoke.
You can help me with this so that I can show the viewer.
Okay, this is the second one. Yes.
So this you call is now the bondo.
Yes, bondo.
Your maggot. We'll be showing you those photos here. You've probably seen the leaves of this maggot. It is. Yes, that is what I was talking about. Those particular leaves. You might have probably seen this ikimea tu kando ya nyumba mahali. Those is that's the maggot, or probably called the moxa, which is now.
It becomes moxa once it's been made.
Yes.
Before it's made is maggot.
The maggot. So yes, so it is dried, and this is a dried leaf. So this is now the original form of it. I can also see something in a cone shape. Okay. Umechukua your first. So this is quite similar to the first one. These are quite smaller. Sorry. Mini moxa pasta.
Yeah. So those ones are this that I was showing here.
Okay.
This that I was showing.
Right.
Yeah.
With
you can see those ones are raw. Those ones are not burned, have not been made to this.
So the difference when you stick this and this, does it have any effect on the body? The different effects?
No. The only difference is one smokes, the other one doesn't.
Okay.
Yeah.
So.
Yeah.
Yes.
So when it smokes, it smells more like marijuana. So that's why we don't use it a lot of this.
Oh, okay.
Because the smell can be very strong and also can get into some clothes. And some people may not like it, but there are people who like it.
Right.
So yeah.
Right.
And then we have
the smokeless mini
moxa. These ones we put them on a needle.
Does that now become acupuncture?
Now this one, when you're using it, again, moxa can be used either directly on its own or can be used with a needle. So in this case, we use it with a needle. So we light it up. So we light the moxa.
Okay.
Once we light the moxa, but we have already put a needle in the body.
Right.
So we put this on top of the needle. Okay. So the needle gets very hot. What is interesting though, you don't burn. You don't even feel the heat of the needle.
Really?
Nah.
Okay.
You don't feel the heat of the needle. So you put that, and then the heat through conduction again, heat is transmitted through the channels that we are trying to open.
Right.
Okay. So then there's the another one. This is the corn moxa.
So what happens for this one?
The corn moxa, you remove it. Actually, I can remove it for you.
And you need shikinione. Yes, it is. So what do you exactly do with this corn?
Again, the corn moxa, again, you still heat it.
Okay.
And then I'll show you how we apply it.
So this is it now direct or indirect?
This is direct moxa.
Direct.
Yes, this is direct.
Unaekelea kama ni hapo kwa mkono?
Yes, unaekelea hapo. Once you wekelea, you light it. Then it starts with warmth. And then you have to keep communicating with the patient to give you the sensitivity they feel.
The intensity of the heat.
Yes, it needs to be warm. And once it gets a bit too warm,
okay. Right, all right. So kuna icon, is there any other?
Now, a few tools that I want to show. We'll need to have this.
A spoon?
Yeah, but you can see it's a special spoon.
Okay, all right, yeah.
Yeah, it's a spoon that has a cutting here. We'll use this to be able to, when you're removing this moxa from the body.
Okay.
So when it's hot, how do you remove it without burning the patient? We'll need to use this.
Right.
We'll need somewhere to put our moxa, with the ash and everything that we use.
Right. Then is that cotton?
Yes, this is because if we're gonna prick, we're gonna have to clean somewhere.
Okay.
So we're gonna use that. And then I'm also gonna show what you call a grain rice moxa. Grain rice moxa is a form of direct moxa, but it's very it's made very small. It's more of a Japanese type of Moxibustion, and that one we light it with incense. Okay, and we use a marker. Also, we use ink. And
so you mark exactly where you're going to place that.
Yes, and then during the time we are doing the moxa, we wear a ring. It's not a marriage ring though, but we wear a ring.
Why exactly?
I'll show you how you use the ring when you're doing the grain moxa.
All right. Speak of which, we'll obviously now be getting into a whole now practical session with our patient here at Kuona how whatever Dr. was explaining, the fact that we now have this.
Now we know the moxa.
And someone knows this. The moxa rolls are in the market right now, and actually the Kenyan market right now. You'd find a moxa, the box, it has about 10 rolls. It goes for about, the price range that I was seeing was about 4,000 Kenya shillings, thereabouts. So this means people have access to this. So someone can buy and use it at home. So my question would be, is it advisable? Would you say we leave this for professionals, or can someone just buy and follow through what you're telling them and then do it at home?
Moxa is a treatment on its own. It's like surgery. It's like any other treatment that you'd have. So before you can use it as a lay person, you need to work with a specialist, somebody who has a knowledge about it. Otherwise, you can cause yourself very severe burns.
Okay.
So you need someone who understands it, who treats you, to be able to guide you on how you can use it. And that's why, actually, next month, the month of August, I've organized with the world-renowned Moxibustion teacher, who is also a master of Chinese medicine. His name is Dr. Luca Pella, to come to Kenya. He's coming on the 28th, in 28th, 29th, and 30th.
Okay.
To teach this to physiotherapists, chiropractors, massage therapists, osteopaths, people who use their hands to treat patients. So we are bringing this guy to be able to help us have more tools. So I'm telling the practitioners that if you want to be the go-to guy, if you want to be the go-to therapist to give effective treatment, then this is an opportunity that will be there for you. Because this is a new art, it's a new science in our country. Yet we have a lot of patients who are suffering from musculoskeletal conditions, who are also suffering from chronic lifestyle diseases. And Moxa, Moxa is more like a magic treatment. You know, it may look very simple, but Moxa where acupuncture fails, Moxa where herbs fail, Moxa works. So it's not just heat, but it's really a very important form of treatment. What I want to educate people first is why are we doing Moxa? I want us to start why we're doing Moxa. And if I can use this. So Moxa is used to help, one, tonify the body, two.
So in layman's language, what does tonify the body?
Tonify the body ni kama kufanya mwili kuwe na nguvu. It's like the body to be strong. Number one. Number two is to help the energy to flow. Inside our body, we have channels. We have channels where this Moxa moves. Number three, it helps unblock blocked chi or blocked vital force. And number 4, it helps warm the body, helps like re-energize. Like when we say people are at the end of life, you know, your body is very weak and you're at the end of life, you can use Moxa to re-energize the body back into health.
Okay.
And for us to understand the channels, I want to use a simple thing to explain.
Right.
One, I'll use this needle. So the first thing we need to understand is that this whole body and all nerves and everything are encased in something like this. This is the connective tissue that encases this. And what we have now, it's a channel. This, if you see through, it's a channel through. And this, we can assume this to be a nerve, a blood vessel, and a lymphatic duct that are going through this channel. Okay? And in this channel, the energy flows in the body as shown in these lines. Okay? As shown in these lines.
Okay.
Everywhere you see a dot, these are areas of where the nerve emerges to supply, be it a muscle, be it an organ, whatever.
So it means that
it's a map of the body.
Let's say if you're putting, let me just have this one of these cones, because you said it's direct. So
yes.
If you're having apple, so do you put it on?
Yeah, let's say you put it here. It's normally put in very, very specific spot. So let's say we put here.
Okay.
Let's say we put there.
Yeah.
When we put there, this patient will feel heat not only there, but the entire body.
Okay.
They will feel the heat travel on that black line.
Even on this side where there is no...
Absolutely. Impulses does not travel as comfortable as it should. Right. So it's like you have a blockage. Now, why Moxa works with acupuncture is that the acupuncturist will come in and put the acupuncture needle on that small space, but the acupuncture will be correcting this, the folding. You see, we'll be able to trying to make this go back into a circumference. At the same time, when we now put Moxa now on the same spot, it's like unblocking a clogged sink, you know, a clogged pipe. So the energy now then will flow to open that flow, so that now the energy can circulate within the body to help re-energize organs, relieve pain. It is actually being used to mitigate side effects of chemotherapy and many other conditions that you may use.
A quick one, Dr. before I have your team or to let mess up and just invite even the patient.
Yes.
Because as you explained, I mean, for that whole channel, even for your nerve system, sahi nikiwa hapa, how do I know that my nerve system has that, as you hypothetically put it, it may block? How do I know? And I mean, I'm standing, I'm moving around very well. How do I know something is not right in me, that I maybe need this?
We say feeling versus function. A lot of us feel okay, but they are not functioning okay. All right? So for that reason, we do a few tests. And the other thing we also do is we palpate, we feel the body. A patient comes, gives you their medical history, what has brought them to you. Let's say it's back problem, let's say it's indigestion, whatever that may be, maybe it's headaches. Once they have given you the history, you undergo through what you call a detailed examination to be able to palpate different areas of the body, like the hands, like the legs, like the head, like the trunk, to be able to find which meridian among these ones is blocked.
It's blocked, okay.
Yes, and the patient will feel with you.
Right.
So once you find the meridian that is blocked, now you have a decision to make. Are you going to use acupuncture and Moxa? Or are you going to use acupuncture alone? Or are you going to use Moxa alone? Okay. So you as the practitioner will decide. In our case, in our office, we try to combine both needling and Moxa, because that way then you get an amazing effect, especially now that we have a very cold situation.
And we're going to see all this. So, Dr. because of time, Taka, we can now get into, because it's nearly half past the hour. I want us to get into now the practical session of it. And I want to invite your team to lete meza hapa, tukaribishe the patient. So even as they do this,
yes.
Is it for everyone? Does it depend on your age? Does it depend on gender? Because this is one of those questions that many people ask around Moxibustion. For pregnant women, can they also get this? Does it exclude a certain demographic of people?
There are side effects to Moxa. One, pregnant women, for example, you don't put Moxa below the belly, or you don't put Moxa at the back. Okay, number one. Number two, patients with the conditions where their body is overheating. You know, like the people who are like very, very hot.
Yeah.
Sometimes you can use Moxa to mitigate that, but sometimes it's calculated as a side effect. Okay, people with very poor skin sensitivity. You know, you have to test the skin. People with very poor skin sensitivity, you can use the Moxa, but again, you have to be cognizant that they can easily burn because of their poor circulation. Small children, if you're doing it on small children, they have to be either held or something so that they don't jump.
Small, at what age? From what age will you recommend?
I've used it on a very small baby. I've used it on a baby who is 6 months old.
Okay.
You know, I've used it. So you can use it any time. It depends on your skill. It depends on your skill as the practitioner. So it doesn't have an age limit. You can use it from 0 to end of life.
Right.
Yeah.
Right.
But again, you be cognizant of the side effects of the condition.
Right. Right. Yeah. So we can have our patient of the day, Karibi hapa, and then now you help us understand all these things that you're telling us. So, anaitwa, what's your name, sir?
Benjamin.
Benjamin. So his name is Benjamin, and he's our maneno yangu hapa kando. So Benjamin has walked in your office, and aliona hii maneno ya Moxibustion akakwambia he wants to try it.
Yes.
So what now? What kind of questions?
So we already took a history and documentation for Benjamin. And his main complaint is pain along the back, number one, and also allergies. He gets a lot of blockages and cold. These are the things that really bother him. So we have done an assessment. So maybe I'll just do more of a demonstration of what I'm gonna do. Come, I'm gonna lie on your face here.
So nikienda mjengo for long, alafu mgongo yangu yanze kuniuma. This is what
Moxa can work for you very well. Okay. So, but today's treatment is not specific to any condition.
Okay.
Today's treatment is a demonstration of how to use the different types of Moxa.
Right.
Okay. So, I want to start with the corn Moxa. Can you move just a little? That's it.
And because you told us that there are two techniques here, there's direct as well as the indirect.
Yes. So we're going to start with the corn Moxa.
Can you use both techniques on a patient?
Yeah, you can.
Okay.
You can.
Okay.
It depends on what you want to do. Yeah.
All right. So the corn.
So I'm gonna start with the corn Moxa, and I'm gonna place the corn Moxa here.
Okay.
Okay. That's why.
Why on the feet?
Oh, the feet. Oh my God, the feet is our foundation of life. I mean, everything in us is supported up by our feet.
Okay.
The feet may be a very small part of our body, but the feet plays kind of the most vital role in how we do. I was telling someone, our grandparents, those who are about 90 and above, have no problem of falling unnecessarily. You see the way sometimes you see people walk like this and they fall in the street unnecessarily. Those old people who did not go to school, those grandmothers who used to go behind the house and get some leaves and make for you matoke or make for you banana, whatever kind of banana or mashed food. They never had shoes. So their stability, their proprioception, what you call the feedback of whatever is coming from the brain to the feet and from the feet back to the brain, has always been perfect. So the proprioception of those people was amazing. So they had no problem of falling unnecessarily, number one. Number two, they least wore diapers. Then let's move forward. My parents, your parents, who are educated, have had all twigs and bells and whistles of modern life and that. They have worn shoes. They all have no balance. They are all walking like this. They all have no balance. They have lost their balance. They are all hurting their joints. They are all hurt. Every part of their body is hurting. They are suffering from all this chronic inflammation. Why? Because we don't put our feet down again to help rear and energize. So
that's the major
feet
reason.
is perfect.
Okay.
It's also number one. Number three, the feet is an aerial. It's an aerial, so it is an antenna that communicates whenever you put your feet, whether you step on a pebble, whether you step on a hole, whether you step on a stick, the feet.
You immediately, yeah.
Yes. So that's why when we use the feet here, you can stimulate again the whole body.
Okay.
Yeah. So.
So you said this should be for about 2 to
3 minutes.
3 to 5 minutes, or?
Yes, but it all depends on how he feels. If it's too much, it can be less, it can be more. Depends on his body.
Okay. How long, how often do you do this?
Moxibustion?
For let's say for this patient, for Benjamin, how long and how frequent should he do this?
Again, it goes with this. It goes with this condition. So when the condition is very active and you want to maintain the body in this relaxed state and help energize the body, you may do it every other day. You can even do it daily. But once his pain is gone and he's feeling okay, you can just do once to help prolong life. Actually, in Chinese medicine, people who had long longevity are believed to have also worked a lot in using Moxa.
Okay.
So what you're gonna feel some warmth. If that warmth is a lot, you let me know. I'll be lighting the next one as this one burning, it's burnt, so that we can have the next point of treatment.
So you just have it on one leg? We're going to have it on both?
No, because this is just for demo. We're only doing one leg.
But let's say if he, now practically speaking.
Practically speaking, it is going to be guided by your assessment.
Okay.
In traditional Chinese medicine and also in fascia manipulation, because again, fascia and TCM, they are like sisters, brother and sister. So you can assess a patient, and once you assess a patient, let me show you. You can assess a patient and find that the patient has a problem in what we call diagonals. You see these dotted lines? These dotted lines are called diagonals, okay? These ones, the straight ones, are called sequences. So the straight ones, you see there are 1, 2, 3. What do? They help us get this movement. Flexion, extension, that's the purple. That's the purple line. Then we have lateral bend.
Help you hold.
Yes,
so that
yes. Lateral bend, moving side to side. It's the blue.
Okay.
And then the black is what helps us turn in and turn out.
Okay.
Now, this is to move the skeletal system, so treating musculoskeletal problems. However, we also treat internal dysfunctions, so like indigestion, gas and bloating, acidity, cold feet, whatever it is. In that one, we work now on the dotted lines. Now, the dotted lines are made by a combination of 2 lines. So this dotted line, the yellow one, carries the lungs, is the meridian for the lung and the gut. The other dotted line is the meridian for the bladder and the entire circulatory system. And then we would have another dotted line. I didn't carry that chart. That would show, or would be on the black one. That one gives us the hormonal component of the body.
So if Benjamin walks into your office, do you have him do these exercises where he bends downwards, maybe moves left to the right and right to the left, maybe looking up, so that you can also examine how
Absolutely. This starts with a detailed medical history from when he was a kid to now. Us wanting to understand, has he ever had any physical trauma, ankle sprains, blunt injury, car accident, name it. Number 2, we want to know, has he ever had a hospitalization, recurrent sickness, recurrent infection? Number 3, we have to look at his emotional health. What has he had? And then after that, we have scans that we take you. There are functional scans that we take you through. You do these functional scans that will help us understand, see the muscle tension, the nerve tension, and the organ function. And then after that, we take you through another questionnaire of nutrition. Of nutrition. And in this nutrition, we want to understand if you have any if you have any food allergies or anything. And then after that, we create something we call the report of finding. Manza kwa moto. Moto sana. Ikikuwa moto sana useme.
So he says it's relative.
It's starting to get warm.
To get warm.
Unasikia inaenda wapi? Where is the heat going? Where? Up to where? Can you show where it is going to?
To the back.
The heat is coming all the way here. But you can see where I've put it. Why does it come here? We can be able to see it from here.
You can see just below that cone, there's quite the smoke emanating.
So at the foot where we have put it, he's feeling it on this meridian.
Okay. So what does that do to his, because as he was telling us,
yes,
in his medical chart,
yes,
kuna uchungu kwa mgongo.
Yes.
So what does this do immediately to that?
It's relax. It's relax the body, and it's like a painkiller. It soothes off the pain. The difference between this and it's too hot. Okay.
So I think about 5 minutes of Zimisha since.
Okay, so you see you put it here, and then through conduction, it's not only here, but it's kind of warm his entire body.
It leaves a particular scar on.
It's actually not a scar, just because of the smoke.
Okay. So if you clean it up, it should be. Okay, all right.
Just smoke.
Right.
Yeah. It doesn't. There's no burn to the skin or anything.
Right.
Yeah.
So, but in case you left it for.
If it gets the skin, it will burn. Yeah,
okay.
Because it's also very strong heat. Yeah.
So what happens? Let's say you're working with patients who might have a certain threshold of pain. They're used to a certain threshold of pain, and they do not tell you. I mean, if you're asking Benjamin, kama ni uchungu niambie. If it's quite painful, you tell me. If
kama ni moto.
Kama ni moto, yes.
Yes.
I mean, definitely.
Yes.
If it's hot, it will definitely be painful to the skin.
Yes.
So, but then some would choose not to tell you earlier. Can you?
You can tell. They'll start fidgeting.
Can you tell? Okay.
They'll start fidgeting.
Right.
You know, when the heat gets more, they'll start fidgeting. So you have to get it out.
Okay.
Yeah.
Right.
So the next one is this one. Turn and face up, boss.
So apart from, because I mean, right now the big question that the viewer would have is why exactly is this happening? Why exactly is he putting, let's say, the cone on the skin? I mean, okay, you've explained to us how from the feet hadi kwa mgongo inasaidia, that's as a painkiller. So the big question right now, even as you continue, is how exactly does it help?
So Moxa is really, most of the time in Chinese medicine we have what we say a damp situation, a damp condition. A damp situation is whereby people are feeling extreme colds. You know, someone may be feeling very, very cold.
Inachukua
a bit of time.
Okay.
Can you light this for me? Light this for me.
So the damp times.
So when you have a damp situation in the body, then we get things like cold feet. We get things like we are shivering. We get things like infection, recurrent infection. Now, when we put the Moxa, and the Moxa is to travel in that meridian in the channel. What it does as it goes in, as I said, it tonifies. It kind of strengthens the the walls on the walls of the channel in the body. It kind of helps these organs to get re-energized. It's like you're putting energy into the tissues, and when you put that energy in the tissue, not only does it feel very good, but it's also again very relaxing, which helps with inflammation. Our key enemy is inflammation. We want to try and reduce inflammation.
So in simple words, inflammation
is not pain. Inflammation is kama kutu. It's like rust in the body. It is what makes us lose gliding. Our bodies doesn't glide as it should. It is what makes us feel that stiffness. You feel like your body is tight. Most people who have pain, they feel like they're in a jail. They feel like they're in a own jail. Like somebody has put them and wrapped something very tight around their body, which makes them feel very heavy to lift their body, lift their limbs, or even to walk. When you do this, what you feel after is you get very light. Your body gets really, really light. Whatever was heavy, you feel like a load has been offloaded. Yes.
Right. So for Benjamin, after that happens, alituambia, he's feeling the heat.
The heat was coming all the way here. Okay.
Uchungu imepungua Benjamin ama bado iko tu? It has reduced. So for how long does this persist? Your kupungua ya uchungu?
Again, if you are treating it as a full treatment and you have done your assessment, we treat every 2 weeks. So his treatments will be every 2 weeks. Why? Because we need also to give the body time for the tissue to change from one form to another. The fibroblast is like the tissues hivi, that tissue has again to something germinates. It's like the way kitu mmea inaanza kukua tena. The body will start now producing new tissue, new healing tissue. So that's why we have to give it a period of 2 weeks. Number one. Number two, also to see the response of the treatment. Did we get it? Did we miss it? If we got it, then we continue. If we missed it, we reassess.
So on the second week, the Benjamin should be telling you kama if it was successful.
Yes.
Anafaa kuambia uchungu ilipungua.
Absolutely.
But, so what happens if uchungu bado haikupungua? It just remains the same.
You need to reassess. Sometimes you need to reassess. Or if the condition has been there for a very long time, you have to do several treatments before you can start seeing that change. Because this is different from taking a pill. This is about stimulating neuronal function. You wanna restore functionality and not just cover or mask the pain. So as the heat and as the treatment goes, the body changes to a point that when you finish your treatment, you're supposed to have zero pain. Though it is not a one-time treatment. Functional medicine, people need to understand, results of a functional medicine takes time. And it's like the way the plane takes off. It's slow. It's slow. You feel it get into your body slower.
Someone would ask, ameona umeka kon kwa mguu.
Yes.
Alafu Benjamin akasema kwa mgongo uchungu imepungua.
Yes.
So someone would be curious, why is it that kon haukuweka nyuma ya mgongo?
Again, as I said, these treatments are very, very, very specific treatments. And since they are very specific treatments, you only apply based on your findings. Now, I'm using these points because I've treated him before and I understand his condition. So I know when I put here what effect I want. I want to relax his thoracolumbar fascia. I want to relax his gut. I want to warm his gut. So putting it there, I know what effect I'll get here.
Okay.
So another one, now we are talking about this one. This one can be used for immunity. Actually, very good for immunity. And a point we can use for immunity is somewhere like here.
So is this?
There's a point here.
This is direct?
This is indirect Moxa.
Oh, indirect, okay.
Yes.
So indirect just basically means it doesn't
touch the skin.
The skin, okay.
Yes. So a point that is very much used in acupuncture for immunity is retrolateral genu 3, okay? This one here.
Just below the knee?
Yes.
Okay.
So what I do, I want to be safe and I don't want to burn my patient, so I would put my fingers like that. I bring the Moxa close here, okay? And I can do two techniques. I can do round, and as I do this, I'm asking him if he's feeling the warmth. Iko warmth. So, or you can do this. So these are two different techniques. One, you take it round as you warm the area. You're putting your fingers so that you can also be able to know when it gets very hot. Okay?
Are you able to do that on my...
Yes.
Ndio ni feel pia?
Yes.
Niambie watu.
Actually, we do it on your ear. We do it on your ear.
Ukushua, hey.
Sitakuchoma, so don't move.
I can definitely feel the warmth.
So this will give you a very good relaxation. Very, very good relaxation. This is a key point that when I give Moxa to my patients to do it at home, I will do here.
Interesting.
Tell us what you're feeling.
There's definitely what you're saying, the whole relaxation.
There's a whole relaxation?
Yes.
So
I can definitely feel the whole warmth hapo.
Yes. And is it spreading?
I think on this to this whole side of the head.
The opposite side?
Yes, the opposite side.
And you see we are not touching it. Why? Because the ear has very many acupoints, number one, and all these meridians that I was showing you, they pass, most of them pass through the ear. So if I'm giving this to a patient who has depression, for example, patient who gets overwhelmed with emotions, this is something I would tell them to do every day in the morning for 10-15 minutes.
Okay. It's definitely relaxing, I'm telling you.
Yeah?
And adequate brain.
Yes.
It just makes you relax.
Yes.
Okay.
So this is how it works. You can feel how your body just goes. Yeah, because when you see it, you may be like, it doesn't work until you feel it. So this is so you can do it here, you can do it in the ear, but I like giving this when I'm giving it to patients to do at home, to do for the ear. Mostly for patients.
Do you do on both sides?
One side.
On just one side?
Yeah, one side. I'll have assessed you. I'll have to assess you to tell you which side to do.
Okay.
Yes.
Or before now, because I think, as I was saying earlier, the fact that these items are on the market,
yes,
some people just buy. I mean, they'll watch what you're saying, or they'll see a TikTok video. They'll go to Dr. Google. You can buy this.
Don't do a
So with about 5,000, 4,000 Kenyan shillings,
yes,
they'll buy some of these materials and they'll go to use it at home. So what's the impact of if you do it with the wrong technique?
Burn. You can cause yourself very bad burn injury. Because as you see this, it's extremely hot. It may not look like, but it's extremely hot. So someone who is somebody who has no training on this should not do it. It's as simple as that. Somebody who has no training on this should not do it. And even you as a patient out there, don't allow a quack who has looked at this on the internet to do it for you.
So umefanyia Benjamin, ukamwelezea, alafu, so is Benjamin allowed to, let's say now, purchase, ama ukimpatia, alafu umemwelezea, this is exactly what you do?
I'll have shown him what to do, and I'll give him the right tool to use.
Right.
Let me have it on your, okay, I can actually do it even here. So we're going to do the palette now. I'm going to needle.
So hapa kwa tumbo.
Kwa tumbo. It's another place you can use it.
That is also going to have an effect on
his entire
ile uchungu iliko kwa the back pain.
Yes.
So
I'll do two. I can do one for indigestion because he gets that a little bit.
It also helps in indigestion.
Absolutely.
Okay. So this is going to be the direct,
this is is indirect.
Mixed with the acupuncture.
Yes, because this one you're going to have to put it. You're going to have to put it on the belly.
You haina uchungu. Ukiweka
a little bit.
Okay. A little. Benjamin uko sawa sawa?
Komoto sana.
Naweza nipatia thumbs up tuone, naweza ambia viewers kwa hapo kwa kamera, thumbs up you're okay. Uchungu ratio iko wapi?
Just a second. Light me another one. This one is burnt a lot.
So you're going to be using this
the needle. Let him burn for me another one.
Smokeless mini Moxas.
Yeah. Before he says that one, I can let me light this one.
All right.
I'll show you a different way of using it.
Nikushikia.
Now, these small ones, we don't recommend patients to do on themselves.
Okay.
These are more risky for you to burn, are more likely for you to burn yourself.
And it's quite hard to have this the charcoal ones.
They take a bit of time, but you have mostly to light them. You use you see like that lighter, like the one for cigar.
Okay, yeah.
That is the one you want to use it. Ours has no gas.
Yeah, na meshika moto vizuri. So as we continue, just run through kind of side effects that might be, even for Benjamin, what kind of side effects?
The biggest side effect when you get done on when Moxa is done on you, is sleep. You really, I don't recommend doing this to my patients and then immediately they get into a car and drive.
Oh, okay.
You can easily sleep.
Oh, yes.
Yes, because the feeling of relaxation is so much and you only want to sleep. So it can be, I don't recommend you just do it and immediately get into the car and start driving.
Interesting. Okay, so there you have it.
So that one we let
make ndani the needle.
Yes, and then
does it go with the exact with the same time that you told us?
Yes,
about 3 to 5 minutes.
Yes, or less. Can even be less.
Okay. So now we actually have about 6 minutes to
finish,
to wrap it up, to wrap up the whole conversation.
So the needle one, let me know, we don't even have them to do it. I can just show you how it works. So you'll have the needle like that.
Okay.
The Moxa on the needle, and then the needle will be inserted. There you go, and then now the Moxa will burn like that.
Or you don't put it exactly on the skin?
No, the Moxa will suspend. So I put something small here to just allow this not to slide. Let me show you.
Benjamin, sawa, how are things?
Okay.
He's giving us a head nod. That means, so what exactly, just to paint a picture for the viewer, leo kitu Benjamin ana feel sahi.
Just warm.
Ndio tukimalizia Benjamin akisimama atakuwa anatuambia what he was feeling.
So like now this one is giving him warmth that is coming all the way to the back and spreading up.
Right. Is that how you're feeling, Benjamin? Oh, okay.
It will feel this.
Okay.
And then the entire body. This one now goes through the needle. So the needle does not get him to burn, but he feels the heat getting into the body. And then the last one, my favorite, is the Japanese one.
So now this, I believe, is a direct?
There's direct and there's the grain size. It makes me remember my grandparents, so I love it. That's why I love it.
Okay.
Because it is all about.
So you put it in.
You have now to be able to make the box.
Okay. So what exactly now? Unaitoa kidogo hivyo?
Unaitoa kidogo. You have to make it into a very small grain size.
So where is now this piece going to be on the part of the body?
I'll show you right now. So if I was to use the same for infection, for immunity in that spot.
Let me hold that for you. If you want, that is how that grain size looks like.
Then I'll need my pete. I will need
the ink.
I'll need the ink.
This is just the kawaida ink ya pen ama what kind of ink is this?
Just like kawaida kind of an ink. And then so I come and palpate.
So palpate ni kuguza. What exactly are you feeling for?
You're looking for something called densification. Lack of grinding, yes.
Okay.
So for example, let's say I find this one here. Okay. Kwa moto sana useme.
Okay. So as we wind up,
on there.
Okay.
Get this. A small grain Moxa. Put it there. So, sorry.
So
anyway, so you would you stick it like that. Oh my goodness, sorry.
Okay.
You stick it like that.
Yes.
And then you light it with the incense.
Okay.
And then as it burns, you put it off.
All right.
So you do like 2-3 times, and again it gives you the same.
On one area.
Yes.
All right. I think we can have now Benjamin anza kusimama so that we can. Okay. Umtoe hizo. Yes. Then we can have Benjamin asimame atuambie how things are, and then tumalizie there. He's good. Okay. Benjamin unaweza let me help you. Right. Sawa. You hauna mic, I think you'll just give us a thumbs up. How is it? It's good? Okay. So, Daktari, you in a sentence, why should someone really get into this?
I think everyone can benefit from Moxa, and everyone should try it if you want to improve your health and wellness. If you experience severe colds, if you experience indigestion, if you experience depression, lack of energy, low immunity, consider an addition of Moxa in your treatment.
All right. Yeah. So thank you very much, Daktari, for taking us through all this, some traditional Chinese medicine. I hope you've learned a thing or two. In case you still have more questions, Daktari, a phone number where they can reach you?
We are the Human Garage in Garden Estate, 0713 030 395 or 7.
Unaweza rudia tena?
0713 030 395 or 7.
Right. So thank you very much for sticking around. This is actually our last Monday show on July. Asante sana for watching. Tupatane kesho on Tuesday with the yours truly Stanley Nyeringita and Fred Indimuli. On behalf of the entire team that made this